The number of people who have died from opioid overdoses has more than doubled in Wisconsin over the last decade, and overdose deaths involving heroin jumped up by nearly 9 times.
News 8's Madeline O'Neill has more on what the state is doing to fight this major drug problem.
Martha and Mike, earlier this year, Governor Scott Walker called for a special legislative session to tackle the state's opioid epidemic. 11 bills came from that session, and now the bills are being assigned to committees. At a public hearing in Madison yesterday, a committee looked at 3 of those 11 bills, and local officials say they're a step in the right direction.
Opioids are getting a lot of attention at the state level right now.
Jen Rumbalski, La Crosse County's health director, is on the governor's task force responding to the state's opioid and drug problems.
Legislative changes are important and essential to really targeting and tackling the issue.
One of the bills coming from the governor's legislative session would allow school workers to provide students with Narcan, a life-saving drug that reverses the effects of an opioid overdose.
The value of having Narcan available, as widely available as possible, to me is not a lot different than having AEDs available.
She says if the bill passes, training on administering Narcan is important,
so that staff and personnel and community members can feel more comfortable with knowing what it is and how to use it.
Another proposed bill would expand grant money for alternatives to jail, such as treatment court, which helps those who are addicted to drugs get help instead of putting them behind bars.
Just punishing people alone doesn't really change their behavior.
District Attorney Tim Grinke says La Crosse County has had treatment court since the early 2000s.
I think our drug court is effective.
It's also expensive, but Grinke says so are probation and prison. So having treatment court as an option makes sense.
What we try to do is have a system where the money we're spending is actually effective. It's changing something so they won't come back. They can start paying taxes. They can be a productive member of society.
Rumbalski says there are many steps to tackling the state's opioid issues.
From the individual and family level to, the policy level.
And the bills are one of them.
And the legislation is a piece of that, a very important piece.
Now, another bill looked at during yesterday's public hearing would add 4 state agents to the Department of Justice to help local law enforcement agencies deal with the growing heroin and meth problems.
Thanks a lot, Madeline. Also, on the national level, some legislators are introducing what's called the Lifeboat Act, which would set up funding to expand access to substance abuse treatment options.